What that means is that you should be gentle in your assessment of this talk because I'm actually giving somebody else's talk. You'll also see that the talk differs in order of presentations. So I know this presentation well because Allison and my partner Chris and I have contributed to this presentation. It's really Chris's in origin, so I wanted to give credit where credit is due. Alrighty, I don't have a financial interest and hopefully won't talk about off-label medication. Alrighty, the goal today in 30 minutes is to really talk about what I would say is an ethical challenge for all of us in healthcare to provide services to kids that respect the heterogeneity that we see in autism spectrum disorders, the variability and also heterogeneity we see in the communities that serve those kids. And people have touched on that for where we send kids back to or the communities they live in, and also the heterogeneity in the families we see. I think all of those 3 points come together in how we serve kids in the healthcare setting. Okay, I did it, I think I did it. Where am I pointing? Oh, there we go. You all know this, you've heard this, that autism spectrum disorder is heterogeneous and it knows no boundaries. There are many of my colleagues here who spend time with diagnoses and also intervention, and you have heard very good talks about this, so I won't go through that. When we talk about heterogeneity and autism, and that autism knows kind of no bounds, we kind of have a cliche that we all use at the Seattle Children's Autism Center. When you know one child with autism, you know one child with autism. So, and that's because there's so much variability in what we see. One of the things that's really variable are kids' cognitive skills. Some kids have intellectual impairments, and their verbal skills are well below average and don't really communicate using language. Other kids are really verbal and talk more than you might want them to, right? We all know those kids. The kids also have most kids with autism that we see, I would say, have some type of sensory processing problem, right? But that's also something that's variable. Some kids are rigid, I would say a good proportion. Other kids are more flexible. I think that if I ask people to think about the number of kids with ASD who are flexible, that would be surprising to the others in the audience. But in any case, flexibility, those pieces, sensory processing, and kids' cognitive skills really have bearing on how we approach them in the healthcare setting. It's really important to note. The other side of it really relies on some of the co-occurring or even the kind of social cognitive kids understanding that kids have when they come into the healthcare setting. So what we might see as a behavioral challenge for kids, for example, in a pediatric appointment, let's say, when they go to urgent care, when they present to the ED, which Eileen is going to talk about, really surround some of the stress that they're feeling in a novel and unknown situation. And I know you're going to talk about that, Eileen, at length. The other pieces of the puzzle that fall into this would be emotion regulation, how well people can kind of come to a stressful situation and cope. That's really a challenge for people with ASD, for many. And as well, the supports that the family has and the child in the community. Okay. I spend some of my time, as does Lynn and Katrina, who are going to come up here later on, supporting families with kids on the spectrum as well. And I think that a large component that we really need to think about as healthcare providers is listening to the family and not coming in with our a priori decisions about what needs to happen for each of the kids. This is Allison's slide, and I'm going to try to explain it. So all of those, I think that it's useful, though. So all of those individual differences, and I'm thinking about them broadly, not, maybe I should just call it, all the heterogeneity a person with autism comes to the healthcare setting with, is kind of like what we think of their capacity, right? it's the skills and who you are, individual difference, both in terms of what you're supported by as well in the community, that comes to your ability to make good choices within the environments that you're functioning in. I think that's what the thought is. And I think it's it's almost like thinking about, when I have a child who presents with autism to my clinic, what do I need in a preparative manner? There are also associated conditions that come along with autism, and in the interest of time, I'm going to go through this really quickly. There are a number of psychiatric issues that we'll see in kids with autism, including obsessive-compulsive disorder, ADHD, bipolar disorder, as well as anxiety and depression. And for those primary care providers, often you're being asked to manage those co-occurring symptoms. I think that was something that was really clear from the Hope clinics. Anxiety is one of the more particularly prevalent disorder that we'll see in kids, and the way that might present in the healthcare setting is agitation, fearfulness, escape, avoidance, right? And we may see in some kids more meltdowns and some self-injurious behavior and aggression. I think that when you see behavioral challenges in the healthcare setting, it's worth to think about how fear or anxiety is pretty powerful. I think that's what we're thinking about. The other piece of the puzzle that we'll often see in kids is depression. And depression looks different in children than it does in adults in general, because we'll see a higher degree of kind of irritability as kind of the demonstration of depression. But what we'll see in kids with ASD often are problems with sleep, difficulties with concentration, and restlessness, and more avoidance than we may have seen in the past. So we're always thinking about the baseline. Some of the medical concerns that we'll see in kids with ASD, this is a lot of information that I'm putting out there because I think our goal is to really think about, what does a kid with ASD potentially come into your office with that you need to keep on your radar? Sleep problems are probably the most common medical concern in 40 to 83% of kids with autism. I would say that 10 years ago, if I go back in time, before the Autism Treatment Network really got off and running, so maybe it's more than 10 years ago for those who are ATN folks out there, sleep was not something that we always asked about in kids with autism. Now, this is one of the first things that you ask about when kids with autism present with attention challenges, anxiety, or depression, and it's part of your intake, right? It's part and parcel, because this is something that's probably one of the more resolvable things for kids with ASD. The other thing that we'll really pay attention to now is, what is a child with ASD's diet, right? Someone who's eating carbs all day long may not be getting enough iron, right, for example. The other piece that we're looking at from a medical perspective are any GI issues that come up for kids as well, and wanting to really act on those pretty quickly. I know that in most of our settings, we have to do a pain assessment, right? Asking a kiddo with autism to do that pain assessment can be a real challenge, right? So the sense of pain can be heightened in some kids with ASD, or it can be lowered in other kids with ASD. And there are lots of gray areas in between. The important thing to note is that kids with ASD are not good at telling you how they feel much of the time, especially in describing their physical symptoms. So your assessment of pain and whether or not a child is in pain can come from the child, and of course you should engage with them with that question, but you're also going to need to rely on behaviors that you might see and that the parents relate to you indicate that the kids are in pain. All right. One of the parts of this that I had this experience that I really want to just share with you very briefly earlier this week. It actually feels like a year ago to me because it was such a challenging experience as a provider. We had a young boy who's 12 years of age who needed to be transported to the hospital because he needed to go onto the inpatient unit at Children's. And it was a really difficult transport for that child. And one thing that was really striking to me in the way that transport occurred, which was the way that restraint was used. Because the assumption, or what I felt like was the assumption of the folks that were transporting this young boy, was that he wasn't going to feel pain. And he did, and they didn't listen to him. They didn't really have a good sense. They actually didn't even look at his face while they were doing the transport. What it brought home to me was that they didn't really understand that because he might not have had the language to communicate what he needed clearly, that he was a person who would experience pain, and also a person where they needed to listen to the people around them, the providers and the parents, in doing that transport. It was a really difficult experience, and there are other people here who went through that experience. It was one of the hardest we've had in a while. But when Allison asked me to give this talk, I thought, this is really good timing, because I think there are important things to say. Now, I'm not sure if this could be my son or daughter when they were younger, but they're teenagers now, so might be appropriate. Anyway, the point of this picture is that behavior is tough to deal with. But sorry for laughing so much. My daughter's 12 now. That's really relevant for me. So the important thing to remember across the board with kids in general, and especially with kids with ASD, is that behavior is a communicative function. How a person behaves is supposed to be telling you that they need something. All right, so rather than see the kid with autism who escapes from your office as non-compliant, which has happened to me with my own, you should try to think about what is the function of that behavior. What's it trying to tell you? And often in the healthcare setting and in other settings, it can mean too much stimulation. I'm overwhelmed. I need to get out of here. I need some routine. I need to know what's going to happen next, right? I need time for transition. I can't just move from one thing to another, switch offices, blood pressure cuff. All of those things can be happening too rapidly. The kids can misinterpret social cues, especially around touch and proximity, and attention can be difficult. You know, the one thing about having autism is that you pick out the most salient cue in the environment, right? And sometimes negative attention is more salient than positive attention. I could spend the entire day talking about that, so I'll stop there. And also, sometimes behavior is a way to just emotionally regulate. Right? So when we're thinking about kids and when we're approaching them, we have some kind of rules of thumb that I think are useful to think about. The first is that behavior is communication. If you take away something because you need a kid to transition or do a procedure, offer an acceptable replacement. Okay, this is like what you do with a really young child, but with kids with ASD in a high-stress environment, this is really critical. It's really important to say what you want a child with autism to do rather than what you want them to stop doing. You want to think about their developmental rather than chronological age. Remember that what you give attention to is going to increase, okay? It's important to know that. And remember the kid's perspective about attention, and always be ready to offer acceptable choices. I think the key, or what we would come to for most of this, is that preparedness is worth a lot. The one thing, as a parent of a child with autism, and as a provider to kids with autism, if you're not prepared, it's going to go south really quickly. It is, especially in the healthcare environment where you're pressed for time unless you fortunately work in a clinic where time is longer and richer in a lot of ways. But really, the reality is that when we have the kids in the healthcare setting, we're not always set up to meet their needs. So there are goals that we have in healthcare visits. There's the child's goals. I want to get out of here as fast as possible. I don't want you to poke me, right? No shots. So you all know, kids don't necessarily like being at the doctor. My son kind of likes it though because he likes to ask lots of questions, but that's unique. The parent's goal is usually to help their kids and to minimize stress for everybody. That's the goal of a parent. And the provider's goal, right, is to get the information they need, to do no harm, and to treat all the kids and families in the waiting room, right? So those are the goals from a provider perspective. Some of them match up. The kid wants to get out of there as quickly as possible, right? We want to be as efficient as possible. But there are intervening variables in there, like managing anxiety, like managing the heterogeneity we see in our kids. So some of the challenges, if we're thinking about all of the heterogeneity that comes into autism of a medical visit, is that it's novel, it's unpredictable. Yeah, I like the sign. It's unpredictable. There's a lot of sensory information around. The environment is loud. The waiting room could have been loud before they even get back to your examination room. There's a loss of control, right? We put the cuffs on them, a cuff on them. They change sometimes. People are looking at things they're not used to having people look at. There's a lot of loss of control for a typical kid and for a kid with ASD as well. We demand compliance, right? We need them to do things they might not want to do. There's also pain involved in some cases, or at least discomfort, and there's fear. And then we're not always set up to make it fun, right? Unless maybe there's a lollipop when you're done, but not necessarily rewards during the healthcare appointment. Okay, so what would some of our goals be? I have 5 minutes to do this. Wow, okay. Some of this, will be on the website, right? So there's very practical solutions in here for people that need them, so I'm going to bump past those. But essentially, what needs to happen is knowledge of the core features of autism, that your staff know how those challenges manifest or might bear out in negative behaviors, let's say. You want to try to be as flexible as you can to the patient's needs. And I think for me, the key thing is a compassionate approach. I can't bring that home enough, and that I think is what really stood out to me on Tuesday. I really didn't feel that the people, sorry, I'm going to try to say this nicely, the people who transported that young boy, I didn't feel they were compassionate. That was really missing in their interaction. And we had worked really hard for an hour to connect, get this guy ready. We prepped him, we told him what was going on, and he was ready to go. But the lack of compassion is, I think, what set him off in the end. And perhaps their running hypothesis was that you don't need to be compassionate with a child with autism, but that's just so untrue. Sorry. Clearly it upset me, but it would have upset any of us. So on a practical level, the first thing to think about, and I think Eileen is going to touch on this too, is preparing the environment to think about your physical space in your offices, right? To think about taking away things that are unsafe and maybe things you don't want broken, potentially, to manage sensory input, right? To consider a private waiting area, which we have, and also to prep your treatment team. And this could be educational for the treatment team as a whole. We spend a lot of time out in the community preparing pediatric practices. Think about the way in which you want to communicate with a child. For kids who are largely nonverbal, that probably means integrating more visual supports to let them know what the routine is going to be, what the exam will be like, even where they're moving to within the office, for example. Know the kids' interests so you can use them and engage them and redirect them and distract them. All of the above, okay? Consider an opportunity for the child to sort of practice going through what's included in a physical exam, for example, without any pressure. And this is, I don't do exams, but the providers have been really clear that your exam should go from distal to proximal. That's probably pretty standard with kids in general. And it's really critical to involve support, right? The parents know their kids really well, right? Parents of kids with autism, they're pros. They're pros in knowing what sets their kids off. They're pros in knowing what soothes them. So in some ways, and I think I watched too much of the RNC convention yesterday and was so horrified. So I was changing this slide. So rather don't ask, don't tell. I said you should ask and tell. I changed it up. Sorry, I had to say something political. I know some people are thinking I can't help myself. So, alrighty. So the thing to know from parents or to ask, and I know time is limited, so maybe you want to think about how do I get this information, but what's the kiddo's developmental level? Sort of know your patient. What kind of communication systems work best for them? Do you need visual schedules prepared in advance? How do they let people know they're in pain? How do their parents know they're in pain? What's the typical home routine? Can the parents bring the visual schedules that they routinely use, for example, right? Can they bring preferred toys? Or can you have a unique preferred toy would be another one. How do the kids react under stress? So what stresses them out, and also what soothes them, what helps them get regulated again. Okay, those are important things to know from the get-go, because a healthcare appointment is kind of uncomfortable, right? Some of the useful strategies, which I talked a little bit before, are really about planning and who you involve in the situation, and as well, to think about using rewards as you go along, especially for kids who you know in advance are going to be more stressed in the environment. All right, I talked about this a little bit, so, all right. So, preparation for procedures will be important, and there's some really good resources that you can provide to parents in advance on the Autism Speaks website that ATN has developed. And we have some as well at Children's if you need those. And the focus here for families in advance of a procedure, for example, is to go through some rehearsal. For us, I'm also working in the anxiety clinic. One of the things we're thinking about there is to expose the kids to the situation so their anxiety is lower once they get to you in the healthcare setting. That's really what we're going for. You should also think about if you have a number of medical procedures to do, get them all done at one time, especially if sedation is available, all right? So if you need to do a dental procedure, and it's a tough one, and there's going to be another thing that a child is sedated for, it's good to match those two things up in time, right? That's really something to think about. And it's a good idea to use EMLA patches for pokes if you have the time. I talked about this a little bit, and that's how you should approach communication with kids with ASD. I think this really runs the gamut. Some kids with ASD really use quite a large vocabulary. And as a provider, we've all made the mistake of talking to them at that really high vocabulary level. So you don't want to talk down, but don't assume understanding. I think that's really what it comes to when we're talking about medical procedures. At the same time, don't think that the kids understand you if you haven't provided visuals to kids who are nonverbal. And I would also assume that the kids are listening, right? The kids are there in the room with you. You're talking to their parents, and maybe they're nonverbal, but they hear what you're saying, okay? So you have to find a way to really communicate what their needs are. Keep your affect calm, which you all probably do. And again, remember that your delivery should be short, straightforward, right? Not a long stream of information with multiple steps is a good way to go about it, and to also offer choices. All right, I'm going to jump to my closing remarks because I'm almost done, and I'm going to try to keep us on time. So essentially, healthcare providers are really on the front line, and my learning lesson this week is that people who transport kids are really on the front line as well. So we have a responsibility to educate all of those people about how to serve kids with autism. And I think what we heard earlier today is that we also need to know about resources for kids with autism and need to be advocates for increasing access in our own communities. I think that's really important to help support all those frontline folks. And preparation, advanced preparation, is probably going to be the key to success. All right, thank you.